Med School meme review. Dr. Mike has done a similar thing before, so I'll leave a link to his video down below. Bring forth the memes! When your non-compliant patient with congestive heart failure goes off meds and starts a high sodium diet. So what this bunny rabbit is demonstrating is pitting edema. So as we're pressing into the lovely fluffy fur of the bunny rabbit, it's leaving an imprint in its forehead. And this is referencing a similar thing that happens in heart failure. So when people's heart isn't working so well, we get a lot of fluid buildup in the body. So the medications we give people are things like diuretics to try and get rid of some of the fluid. If that's not working very well, then all this fluid ends up pooling in the tissues, particularly in the legs due to gravity. So in our cardiac examination, we look for fluid in the legs by pressing down on the skin and taking our thumb away. And if it leaves an imprint, like on the forehead of this bunny rabbit, then we'd assume that the patient has pitting edema, so caused by fluid in the legs. Guide to OSCE 101. Patient talks. I'm sorry to hear that. That must be difficult for you. This is such a classic thing that all med students will be able to relate to, because when we have our practical exams, that's what we call the OSCEs, we have lots of stations where they can test us on anything from, clinical examination to procedures like blood taking to more communication and softer skills like this. And clearly in the exam, we know it's not real. So you kind of have to just pretend you're empathizing with the patient. So that's why you have to use these phrases like, I'm sorry to hear that, that must be really difficult for you. And it does help when you have to do it for real, but obviously when you do it for real, there are a lot more real feelings that come along with it, rather than this kind of press a button manufactured feelings that you have to show in the exams. When you go through 8 elaborate steps but end up with only 2 ATPs. It ain't much, but it's an honest work. The Krebs Cycle, oh my God. I haven't learned about the Krebs Cycle in so long. So this is how our cells in our body make energy. So you remember those little mitochondria that are the kind of powerhouses of the cell. That's what you're supposed to say, isn't it? They use this process in the Krebs Cycle to generate energy, kind of this energy molecule called ATP. And when we've got plenty of oxygen, we can do a very efficient way of creating energy in the process of respiration that uses the Krebs cycle on its way. And we can produce 38 of these ATP energy molecules. However, when we don't have enough oxygen available, we switch to anaerobic respiration, which produces only 2 ATP. And it ain't much, but it's honest work. How it feels doing fundoscopy. This is exactly right. If you guys have ever had it done on yourselves, so the fundus is the back of the eye, so it includes the retina, the optic nerve, and a few other structures. And we examine it in a process called fundoscopy with this kind of scope that we use. And let me tell you, it ain't that fundus to do, because you have to turn the lights off and get extremely close to the patient. And there's very few things you turn the lights off and get extremely close to someone, right? Teaching the med students how to do digital rectal exam for the first time. So DRE, digital rectal exam, digital meaning finger, rectal, your back passage examination. You know the rest. I have to teach this exam pretty much every couple months to the med students I teach. It is a funny session. I have this kind of giant action man bottom that I have to demonstrate to them. Weirdly enough, the younger medical students, the 3rd years, always get a bit giggly, and the 5th years, we've shaken it out of them by then. In 1847, Robert Liston performed an amputation in 25 seconds, operating so quickly that he accidentally amputated his assistant's fingers as well. Both patient and assistant later died of sepsis, with a spectator reportedly died of shock, resulting in the only known surgical procedure with a 300% mortality rate. At least you tried. I've heard of this case before, but I didn't realise a bystander died as well. However, let's think back. I mean, the picture here shows like a modern day operating theatre, but things were very different back then. So for a start, we didn't have, antibiotics to kind of stop these wound infections. So we'd have a lot of amputations. And also we didn't have general anaesthesia for operations. So the only way to do things, like humanely, if that's even the right word, is to do things as quickly as possible. Hence why, Robert Liston would have done things extremely quickly and kind of in a rush end up cutting off his assistant's finger. Again, we wouldn't have antibiotics, so this is why the assistant, would be highly in danger of getting a nasty infection and that, turning into sepsis. And thanks so much to Med School Memes for allowing me to use all the images they've collated. Much appreciated, guys, and you should definitely check out their Facebook page. I'll leave a link in the description below. Doctors before an x-ray be like, don't worry, this is perfectly safe. And then the dude goes to Egypt to press a button. That's absolutely right. We don't want the radiation. No, radiation in small doses is pretty harmless. We always want to limit the amount of radiation we expose to anyone. So we'd only do tests that we feel are absolutely necessary. We'll add something to the picture. Things like chest x-ray, though, have a very small amount of radiation. It is a consideration if people are having kind of lots of scans, particularly things that have more radiation like CT scans and things like that, because these things do add up over time. So that's why we want to protect staff that use these machines, and generally speaking they're not doctors, they tend to be radiographers that operate the machinery, and so we don't want them to get exposed to stuff all the time. So that's why they look like they go to Egypt to press the button. In reality, they'd be standing behind a screen. So I heard that you two finally tied the clot. Sure did. Coagulations. Terrible joke. That's not a meme, that's just a dad joke. When a med student forgets his headphones at home. I wonder if that works. I have to play the Sick Notes theme tune so I don't get copy strike. Pretty good, but it sounds terrible. So there you have it, my look at some medical memes. But before I go, bonus meme. Well, it's not really a meme, it's more like a last month I asked you, a why. So I asked you guys what this meant. 28F, Bieber, 3/7, riff pain, N plus V, BNO, 1/7, PMHX, nil, G1P1, LSCS, DX, COCP, NKDA, FSHX, independent of ADLs, 1 point for decoding it and 1 point for a differential diagnosis. Let's see what some of you guys said. What the actual hell do they do to doctors nowadays? I know, genuinely, if you give that to a doctor, they'd be able to read it just like it was English. I have no idea what you said, but I'm 110% we can cure this with the power of prayer. He needs paracetamol. It's a female, that's one thing I'm going to give you, but we probably would give them paracetamol. Definitely lupus. A bit of a house-inspired one, that one. Ligma, maybe. Oh, ligma, the disease that's spreading on the internet. I diagnose you with dead. If you left this patient, they could possibly die, so not totally wrong. When in doubt, check the poo. Stop trying to get the internet to do your work. Damn it! Busted by Original Pie Man. Considering their location, riff pain, perhaps appendicitis. Oh, we're on to something. Queen to H6, checkmate. Did I just win a game of chess? Ectopic pregnancy, pretty sure this is it. Very good guess, Felicia. You're onto something as well. Oh, and 28-year-old female brought in by ambulance. Yes, some people are doing well. My guesses are diverticulitis, appendicitis, or ovarian cyst. Pretty good going. Overall, I'd give you guys a pass, but let me give you the answers. So 28F means 28-year-old female. Bieber doesn't mean this Bieber. It means brought in by ambulance. That 3/7 means 3 days. So they've had 3 days of riff pain. That doesn't mean this kind of riff. It stands for right iliac fossa. So this is our abdomen or our tummy. We divide it up into 9 areas, kind of for simplicity, but also to document things. And different diseases tend to cause symptoms in different places. So just briefly, up here we have our epigastric area. Then below the ribs, we have our left and right hypochondrium. Hypo means below, chondrium ribs. So below the ribs, that's these areas. We then have our left and right lumbar regions, sometimes called the flank regions. We have our umbilical region. Umbilical means your belly button. Just above here, we have the suprapubic area, sometimes called the hypogastric area, so below the kind of stomach, but sometimes suprapubic because it's above the pubic bone. And then we have the left iliac fossa, so this part of the pelvis is called the iliac bone. So this is our left iliac fossa, and this is our right iliac fossa. Therefore, RIF stands for right iliac fossa. So the patient's got pain in this area. N plus V, so the patient's had some nausea and vomiting. BNO 1/7, bowels not open for 1 day. So all of this pain here, nausea and vomiting, bowels not opened, are all sort of pointing at a problem wrong with the gut, possibly. PMHX means past medical history nil, so they've had no kind of significant medical history before or no sort of underlying diseases. G1, P1, LSCS, that stands for gravida 1, so they've had 1 previous pregnancy. P1 stands for para 1, so that's 1 previous live birth, and that was via a lower segment cesarean section. So this patient's had previous operation before, a lower segment cesarean section to deliver a baby via the sunroof. So DXCOCP, so the drug history is the patient's on the combined oral contraceptive pill. This is probably my one mistake in it. I should have put DH, so drug history. DX we normally use for diagnosis. This is why abbreviations are really bad. NKDA, no known allergy. So the patient is on the combined oral contraceptive pill but has no drug allergies. FSHX, nothing to do with fishes. It stands for family and social history, and that's so the patient is independent of their activities of daily living, their ADL. So this is a 28-year-old female, usually fit and well, no significant medical history, that's come in with 3-day history via ambulance, so it must be really bad, of pain in the right iliac fossa. So our top differentials, I really would worry about something like an appendicitis or an ectopic pregnancy. Bonus points as well, she's had previous surgery as well, and her bowels are not open, so we'd also want to rule out some kind of blockage, some kind of obstruction of the bowels. So there you have it, guys. I hope you enjoyed my look at these memes and also my little medical challenge I set you guys. You can check out Instagram and Twitter and my community page as well on YouTube, and there's another one of these medical tests that you can have a go at, and I'll check it with you guys in another video to see how you guys got on. And yeah, why not sub to PewDiePie? I know he's a bit of a controversial character. I like the guy, and I think he does represent the you in YouTube, the independent YouTube creator. You know, for all his faults, none of us are perfect. I think he's, you know, a good guy to have around on YouTube. So this is my little nod to him. And as always, guys, thank you so much for the support on the channel, all the likes, all the shares, all the comments too. I really appreciate it. I hope you enjoyed this kind of more of a fun, relaxed video. So until next time, I will see you guys soon.